love working with OT, and I don't think I can get through my day without my OT call.
And then watch the faces of the patients and families light up, knowing that they can actually improve their quality of life despite whatever it is that they've gone through here. And that makes me feel like I really cannot ensure that my work is complete if I don't have an OT member.
OTs are advanced problem solvers. No matter what difficulties our patients are having living at home or wherever they are, it seems that the best person to consult and see how they can solve that problem.
Interprofessionalism, reaching out, participating in the goals of the program, actually having a voice in pieces. I was just really astounded by that.
The assessments that they do around cognition and functioning really do, as Julia said, impact all of the work that we do. It's this vein that runs through every patient that we see.
Look at gait, look at cognitive assessment in a totally different way that is much more meaningful, not only from the family perspective, but from the caregiver perspective as well, and from a team perspective, that it goes beyond our standard cognitive testing. We finally understand what an Allen test is about.
I love working with OT. As a speech-language pathologist, I understand the unique role of occupational therapists on our stroke team.
We want to really make sure that before we discharge anybody home, that they're safe, and Angela is a key component of that care that we provide.
Occupational therapists exercise great compassion towards their patient.
And then any strategies for dementia management or delirium prevention. I find the OT are super helpful and knowledgeable about that, so I'm always using them for that. Thanks, guys.
It really celebrates in the gains that they've made and the progression that our patients do.
Very pragmatic approach to patients' ability to function day to day.
They are wonderfully collaborative, and they help us understand the impact of impaired cognition on function.
And then making holistic recommendations. It's really helpful for the team and really helpful for me in planning my interventions with the patient, and I think it's very helpful for the patient getting to where they want to be so they can go home.
Their ADL assessments and cognitive assessments are really important to making sure that patient is supported at home or determining what type of level of care.
Think of the people with visual spatial impairment and the tips that was created to help them manage at home, completely OT driven from this hospital.
Get the right cheers for patient help the patients get ready for rehab.
OTs get the big picture about our patient. They understand what's most important to our patients.
Valuable thing that OT brings is that they look at the patient from a whole.
Patients who they think may not be able to manage their medications at home on their own and suggest blister packs when needed. So it's helpful for me to be able to arrange that before discharge.
OTs are such key members of the acute care team that I work with.
There are clearly advantages of having an occupational therapist here at the clinic because there's certain disorders which are unique. That by having a close relationship with an OT who understands the nature of these very specific types of dementia disorders, that together we can come up with additional strategies that will help this individual person.
I find myself pulling on my OT on my team a lot, and to help make sure that we are planning for a safe and appropriate discharge. I think if we don't have an OT on our team, there's a huge gap in the service that we're able to provide.
Happy Occupational Therapy Week, everybody.